All right, let's jump right in. Today, we're going to talk about one of the toughest, most persistent problems in the United States, these huge gaps in health outcomes between different groups of people. But we're also going to explore a pretty surprising idea, how the actual words we use, the messages we send about health, might be a small but really powerful piece of the puzzle. Okay, just take a look at this. These numbers from 2021 really lay it all out. The difference in how long people live in the US is just staggering. A 19-year gap. That's the difference between the longest living group, Asian Americans, at 84, and the shortest living, Native Americans, at just 65. Think about that. That's almost 2 decades of life. For Black Americans, the average is 71. This isn't some tiny statistical blip. It's a massive, profound problem. So the natural question is, why? What's going on here? And what's interesting is that the US Census Bureau is very, very clear on this. When they talk about race, they're talking about a social idea, a social construct. It's not a biological thing. It's not in our genes. So whatever's causing these huge health gaps, we're not going to find it in our DNA. We have to look at our society. Okay, so that brings us right to our first big section. What are these complex things that are actually driving these life or death differences? Well, research shows it's this whole tangled web of issues. You've got structural racism that's baked into systems like housing and education. That in turn really affects socioeconomic factors, things like your income. Then there's the well-documented implicit bias that happens inside the healthcare system itself. And we can't forget about environmental racism. The fact that communities of color are far more likely to be located near factories and pollution. These are really deep systemic issues. And it's really tempting to think, oh, this is just about money and education. But the data shows it's just not that simple. Even when you account for income and how much school someone has had, these racial gaps in health are still there. They don't go away. And this right here, this single statistic is it's absolutely jaw-dropping. Let it sink in for a second. A Black woman with a college degree is still more likely to die from pregnancy-related issues than a white woman who didn't even graduate from high school. So yeah, it's pretty clear there's something else going on here that goes way beyond just class. So this leads to a really tough question. When the problems are this big, this ingrained in the system, where do you even start? It can feel a little hopeless. But some researchers are looking in a really surprising place: our communication. Could something that seems so small, like a health ad on TV, actually help move the needle? So to dig into that question, we're going to pivot and look at this fascinating study that came out of Chile. Now, the context is different for sure, but what they found about the psychology of how we persuade people, well, it has some really powerful lessons for the issues we're talking about. It's all about how different kinds of messages convince different people to make healthier choices. The study basically boiled it down to 2 classic strategies. On one side, you've got fear appeals. These are the messages you've all seen. They warn you about all the bad stuff that'll happen if you don't change your ways. Sickness, disease, death. Then on the other side, you've got hope appeals, which focus on all the positive things you can get. More energy, feeling great, a long, healthy life. But here's the kicker. The whole point of the research wasn't to figure out which approach is better in general. No, the big insight they uncovered was that the most effective message completely depends on who you're talking to. So the study found that those scary, fear-based messages, they really worked for some specific groups. They were more persuasive for people who eat a lot of fast food, for people who already see themselves as overweight, and, this one's kind of interesting, for people who already have a history of eating healthy. Maybe that fear just reinforces the good habits they've already built. But on the flip side, those positive, hope-based messages, they landed with a totally different crowd. They were way more persuasive for people with high self-efficacy, which is just a fancy way of saying people who really believe in their own ability to make a change. They also worked better for people who care a lot about what their friends and family think, tapping into that social support network. So the bottom line, the big takeaway from this advertising study is actually super simple, but it's incredibly powerful. Sending out one generic, one-size-fits-all message to a big, diverse group of people, it just doesn't work. To actually get through to someone, the message has to fit their mindset. And this is where it all comes back around. Look, is a better ad campaign going to solve systemic racism? Of course not. But this study shows us something critical. If a community has been systematically held back, do they have that high self-efficacy to respond to a hopeful message? Or if you have a long history of being ignored or mistreated by the medical system, do those fear-based messages just feel like another threat instead of a helpful warning? The fight for health equity isn't just about building more clinics. It's also about understanding these different mindsets and tailoring how we talk to people so we can actually connect and empower them.
So it leaves us with this final, really challenging question to chew on. If a one-size-fits-all message fails so badly, what other standardized cookie-cutter approaches are we using that are also failing? From the way we design public health policies to the kind of medical treatments we offer, this idea really challenges us to think deeper, to get more specific, and to figure out how we can finally close that 19-year gap.